How does Medicare hospice coverage really work? If you or a loved one is facing a terminal illness, understanding how Medicare hospice coverage works can be a source of comfort. Let's break it down together. Medicare hospice coverage is part of Medicare Part A, which is hospital insurance. This benefit is specifically for individuals who are terminally ill, meaning they have a life expectancy of 6 months or less if the illness follows its normal course. To qualify for this coverage, the patient must be entitled to Medicare Part A and certified as terminally ill by both their hospice doctor and, if applicable, their regular doctor. This certification is based on medical prognosis, considering the patient's diagnosis and other health conditions. Once a patient is eligible, they must choose hospice care. This type of care focuses on comfort and palliative treatment rather than trying to cure the illness. The patient signs a statement to elect hospice care instead of other Medicare-covered treatments for their terminal illness. However, they can revoke this election and return to standard Medicare Part A coverage at any time. Medicare hospice coverage follows a structured benefit period system. There are 2 initial 90-day benefit periods, followed by unlimited 60-day benefit periods. Before the second 90-day period, only the hospice physician needs to recertify the patient's terminal status. For the third and any subsequent benefit periods, a hospice physician or nurse practitioner must have a face-to-face encounter with the patient to confirm continued eligibility. Hospice care can be provided in various settings, such as the patient's home, nursing homes, inpatient hospice facilities, or hospitals if inpatient care is necessary. The hospice care team typically includes doctors, nurses, social workers, counselors, and volunteers. They work together to develop a personalized plan of care in collaboration with the patient and their chosen attending physician. This plan is reviewed and updated at least every 15 days to reflect the patient's changing needs. Medicare hospice benefits cover many services focused on comfort and symptom management. This includes nursing care and physician services related to the terminal illness, medical equipment and supplies for symptom control, and prescription drugs for pain relief. Additionally, hospice aid and homemaker services, physical, occupational, and speech therapy related to the terminal illness, social work services, counseling, and spiritual support are included. Short-term inpatient care for symptom management or respite care for caregivers is also part of the coverage, along with bereavement support for the family after the patient's death. Typically, there is no cost-sharing for hospice-covered services, except for a small copayment for outpatient prescription drugs and inpatient respite care. Patients have the right to choose their hospice provider and may change providers once during each benefit period. They can also revoke hospice care at any time and later re-elect it if desired. In essence, Medicare hospice coverage provides a supportive environment focused on comfort and quality of life for terminally ill patients who meet specific eligibility criteria. With structured benefit periods and a collaborative care approach, this coverage aims to meet the unique needs of each patient during a challenging time.